Welcome to Fit and Pain-Free the Bonnie Prudden Way. I'm Enid Whitaker, and I'm joined by Sandy Dirks. Our program each month will center around fitness pioneer Bonnie Prudden and her accomplishments, her method of exercise, and pain erasure the Bonnie Prudden Way, or Bonnie Prudden Myotherapy, which is a way to get rid of muscle-related pain. Join us as we begin each meeting with a few tension-relieving exercises.
In today's program, we'll be talking about Bonnie Prudden Myotherapy. Bonnie Prudden was not only a pioneer in physical fitness, she was also a pioneer in the field of bodywork, specifically combining trigger point therapy with her methods of exercise and fitness. So we'll be talking about how she discovered it, how she first started working with Bonnie Prudden Myotherapy, the total history of Bonnie Prudden Myotherapy. And Enid will start us off.
Bonnie introduced the words trigger point and myotherapy to the world in 1980 when she released her book, Pain Erasure the Bonnie Prudden Way, which became a bestseller. Up until then, the words trigger point were not known by the general public. Trigger points were pioneered back in the 40s by Dr. Janet Travell, and she made maps of the trigger points and referred patterns of pain. Bonnie was introduced to pressure to trigger points back in 1938 by Dr. Hans Kraus. He was her climbing partner, and she came down from the hotel room to climb, and she had a stiff neck, and it was painful. And he said, well, I don't have my needles here with me, but let me try my thumb. So he pressed into her neck very hard because she said she thought it was coming out the other side. And when he released it, the pain was gone and her head was on straight. And then she went climbing and didn't think anything more about it. The next time she was introduced to trigger points was trigger point injection, and that was by Dr. Hans Kraus too. Bonnie fractured her pelvis when she was 23 in a skiing accident, and she fractured in 4 places. And that led to her wearing a leather and steel back brace. And he noticed that she had this brace on when she was climbing. And he asked her about it, and she told him, and he said, well, I think I can help your back pain. So that's when he started to give her trigger point injections. And he followed it with exercise, rehabilitative exercise. And then when in 1976, I know that's a jump from 1943 to 1976, Bonnie was working with Dr. Tivey, who was in Stockbridge, Mass. He was an internist and he was trained in England. And he had a very open mind, he said. He said he almost fell through it. It was so open. And he started sending her patients because he wanted to inject trigger points, but he didn't know how to find the trigger points. She knew how to find the trigger points, but of course she wasn't a doctor, so she couldn't inject. So the patient would come to her, she'd find the trigger points, draw a little circle and an arrow, send them back to Dr. Tivey, he'd inject, and then he'd send them back to her for the corrective exercise. Until one day, she was working with a patient who had a stiff neck, and she really doesn't remember or know what she did, but she was looking for the trigger points in the neck. And the woman said, "Oh, ouch, that hurts." And then the pain was gone. And that's when she remembered back to 1938 when Dr. Krause stuck his thumb in her neck. And she wrote about this in many of her books, but in one, she says after that, "And I felt a Mona Lisa smile coming on." And then the next patient had elbow pain, and she said, "Well, I've found some things that might work. So can I try them on you?" And the patient said, "Sure." Well, she went looking for trigger points, and the woman's elbow was fine. And the next one was the shoulder, and the same thing happened. And then Dr. Tivey was wondering why he wasn't getting his patient back. So that's when they started working together on this method of pain relief. And it's different than most methods of pain relief in that we believe that you'll have your own pattern of trigger points. There are common trigger points, but each person has their own pattern of trigger points depending on how they've used their muscles. For instance, if you played a sport, each sport has its pattern of trigger points. Your occupations do, and whatever exercise you do. And even your birth can have a bearing on where your trigger points are. For instance, if you have to be pulled out, or if you come out one shoulder leading or something like that. And your hobbies or any musical instruments you might play have a bearing on where your trigger points are going to be. So that's one difference. A second difference is that we always address opposing and adjacent muscle groups, because all the muscle groups pull on one another. So if you only do one set of trigger points, and you say you do the chest, but you don't do the back, if you're working with a shoulder, those muscles all connect with the shoulder, as do your arm muscles. So all opposing and adjacent muscle groups are addressed along the length of the muscle. So it's not just one or two trigger points, it's a whole line of trigger points. Then the other thing is that while the patient is on the table after each muscle group is worked, then we do passive exercise, because the muscle has a memory and you have to teach it a new habit. It's like children, and they have habits, and you have to keep reminding them that they have to learn a new habit. So muscles have memory. You teach them a new habit. Then when the patient goes home, you give them corrective exercises, because again, if you just leave the muscle hanging there and don't teach it a new habit, it's going back to its original spasm or tension pattern. And so the patient is told how to do the exercises, just 4 repetitions at a time, but often throughout the day. You can't just do them Monday morning and expect that Monday afternoon the muscles learned it. All through the day. And then the other thing that distinguishes it from other disciplines is that, hey, you can learn it. There's no needles. You have your elbow, your fingers, and your knuckles, and that's what you do to do myotherapy, especially if you're working on somebody else. It's simple, it's efficient. We teach it to children, so everybody should be able to learn it for their particular problem. The other thing that's kind of unique is that, and this is what Dr. Tivey said, he says it's kind of like a diagnostic tool. If the Bonnie Prudden myotherapy doesn't work, it probably means there's some kind of pathology that needs to be taken care of medically. And so if for instance you needed a hip replacement, the myotherapy could help relieve the pain and make you more comfortable until you decide you're going to have the operation, but it's not going to fix the problem. So it doesn't ever cover up anything.
Well, I'm going to backtrack a little bit here. because from what I understand, when Bonnie was first working with trigger points, she followed some of the patterns at first that had the major trigger points, ones that she had learned through having injections on herself. But then, was it true that she would lie down on her kitchen table with an anatomy book and have somebody press on places to work out the patterns?
Oh, yes. When we first started, she came up to my house in New Hampshire, which was in Durham, New Hampshire, where the university is. And we went to the university bookstore and we got all kinds of anatomy books. Then we came back and she lay on my kitchen table while I put my elbow here, there, and everywhere and marked it with a black marker. And so that's when we started to find out where the major trigger points and what their patterns were going to be. And then eventually, she lived in Stockbridge, Mass. So there were lots of different groups there, like the jockeys came to town for the fair and the musicians went to Tanglewood. So these groups of people would come and we would keep noticing that each group had a different pattern of pain. And that's how we started to establish those patterns of pain for different occupations and hobbies and musical instruments and occupations and so forth, sports and so forth. And the staff was really, really young, and we would work on anybody we could get our elbow into. And then we'd have meetings every week and everybody would tell what they had found. And so it was really a group effort, a trial and error, and just working together and finding out what we could about how long you needed to hold the pressure, how many points you needed to do to get the job done. And it was a fun time to be in on something that was groundbreaking like that, although we didn't realize it was groundbreaking at the time. We were just doing our thing for Bonnie.
Yes, and helping each other. So the very first thing that she did before the pain erasure book was a smaller book, and I can't pronounce the name.
Dolor-Phalax.
Okay, and that was the very first book that she put together about myotherapy. Is that correct?
And that everything that we did really has a story, because she was friends with Arlene Francis, who was a radio and TV talk host in New York City. And every time we go into New York, she'd do a show with Arlene on the radio. And we went in, did the show, and it was taped. And it was aired in a snowstorm, and everybody was home. They couldn't go anywhere in New York. And what it was advertising was the pain erasure clinic that we were having in Somersworth, New Hampshire. Where was Somersworth, New Hampshire? It was a little bitty town, but the office was inundated with phone calls from New York for the first ever pain erasure clinic. And because we were having that, Bonnie put together this little booklet. We mimeographed it all. A mimeograph machine, didn't even have copy machines. Mimeographed it off of there for our first ever pain erasure clinic, which was a kind of an, oh my God, what's going to happen next kind of thing, because nobody had ever done it before.
I love it. Okay, so that was the beginning. That little booklet became the inspiration for the first book. And actually, other people have researched it. Pain Erasure is the first book published about trigger point therapy.
Right. And because Bonnie was not medically trained, other than what she learned from Dr. Krause, she didn't have a degree. She barely got through high school. She just had lots of vision and common sense. And this is true about all of her programs, including the fitness program. she wanted everything to be simple and fun and get results so that everybody could enjoy being fit and pain-free. So the book was not written for medical people, it was written for the lay person. And I don't know how many books have been sold, but it's still going. And that was in 1980. It was published by a very small company, M. Evans. They sent us on a 23 city book tour. We were exhausted, but happy. So that's how trigger points and the word myotherapy got introduced to the general public. Now, Bonnie did not register myotherapy as a trademark until a lot of different people started using it in the bodywork field. And then people became confused because they weren't really doing what we were doing. So we would get calls from people trying to figure out what the difference was between what we did and what other people did. So that's when she trademarked or registered her trademark as Bonnie Prudden Myotherapy.
Yes, and so and again, just like all of her fitness books, she really wanted people to be able to help themselves.
Right.
And so while there are professionals, we're professional certified Bonnie Prudden myotherapists, the main thrust forever for Bonnie Prudden, and that's again why she wrote these books for the general public, was so that anybody could pick up a book, take a look at it. Pain Erasure is like a recipe book. It's, the chapters are how to fix your back pain, how to relieve yourself of headaches, and while it does show you how to work on somebody else, because when I first started, I remembered that a lot of times at workshops, we would say, bring somebody with you and we'll show them how to work on you. A lot of people didn't have somebody. And so while we're more than happy to show somebody how to work on somebody else, the family member, it's also really important to notice that you can also learn how to work on yourself with the combination of finding the trigger points yourself and then doing the corrective exercises. And it really is all based on your history, how you've used or misused or not used your body throughout your lifetime.
Right. So I don't even think we said what a trigger point was.
Okay, good.
A trigger point, well, like everything else, there's controversy about trigger points.
Yes.
For our purposes, a trigger point is an irritable spot that gets in the muscle when the muscle's injured in some way. And when it lights up, so to speak, it throws the muscle into spasm, and then you get your spasm, pain, spasm cycle at its worst, where they say, oh, my back went out, or, I have a migraine or whatever. But actually, your back didn't go out, it went in spasm.
Right.
So we apply pressure to the trigger points based on what you've told in the history. And we hold it for 5 to 7 seconds, let off the pressure and go along the line of the muscle, opposing and adjacent muscle groups, and then do the passive exercise and go on to the next muscle group.
Yes. And it is specifically the reason why we call it Bonnie Prudden Myotherapy, not just myotherapy, because what we do is different. Anymore, there are many people who say that they work with trigger points, pressure points, myotherapy, and that's all well and good, but it's not specifically what we do. And I really do feel that the trigger points, releasing the trigger points, allows you to exercise. And it's the corrective exercises, the range of motion exercises that take you the rest of the way to pain relief, lasting pain relief.
Right. And when Bonnie was working with Dr. Krauss, she actually, when he would do the trigger point injection, and then she would do the exercises that he told her to do with the different patients. However, and he felt that was very important. He made his patients come into New York and do their exercises faithfully because he knew it was so important. However, his exercises were kind of cumbersome. There were many of them. And he was known as the back doctor in New York, also the ski doctor, because he got everybody back on the slopes quickly. But Bonnie wanted it to be simple and effective. And because of her training in many different modes of dance and exercise, that's why she developed her own method of Bonnie Prudden exercise, which then became the corrective exercises, specific exercise for each muscle group to retrain it.
Yes. And it takes the muscle through range of motion.
Right.
One thing that also always struck me whenever I would watch Bonnie talk about myotherapy and the history of it, she used to, you probably remember this a little bit better than I do. She would draw a little chart. And I think acupuncture would be here and acupressure would be there. What do you remember? What was it, 4 different things, or was it just the 2?
Yeah. It was acupressure, and then Bonnie Prudden myotherapy, and acupuncture and trigger point injection.
Yes, and there are many therapies that apply pressure to muscles to relieve pain. Shiatsu is another one. And if you think about it, a lot of times when you hurt something, you hold it, right? So one thing in the pain erasure book that Bonnie said is, there is nothing new under the sun, or moon either for that matter. Everything was always here in one form or another. Dr. Travell says myotherapy was born of serendipity. Dr. Tybee says it came about because known facts were seen from a different angle, without the limitations imposed by long training in one field to the exclusion of knowledge in most others. Whatever the elements gathered during its gestation, whatever or whoever is responsible for its birth, myotherapy is here now for you to use. Use it in good health. Bonnie Prudden. She was a very giving person. She always, whenever she learned something she wanted that was useful, she wanted to teach it to others. And again, her thrust was to help people to live the fullest life that they could, without pain, without restrictions, no matter where they started.
Right.
Enid, what's our exercise of the month?
Our exercise of the month is called edging, and it's for the ankles and feet and a lower leg. Our feet take us where we want to go. So it's important that we have strong, flexible feet and ankles and lower leg muscles. And as Bonnie says, keep fit, be happy.